we think of a phobia as a really extreme, irrational, and persistent fear of something that in reality poses little or no danger. So common examples of phobias would include a person or an animal. So you can think of like clowns or insects, a place or a type of place. So you can think of examples might be like a hospital or a graveyard, something like that. Type of object, such as a needle or knives. An activity, like swimming or riding in an elevator, or a situation like being alone in the dark. So at its core, a phobia is an anxiety disorder. And anxiety disorders are conditions that activate your fight or flight response and create feelings of imminent danger when there really isn't danger present. In terms of phobias, they will create a feeling of fear that is so intense when the child is either in the stimuli or they're thinking about the stimuli that it will interfere with their functioning. They are fairly common in kids. So the percentage and the prevalence is about 10%. But a really important thing to know is that there's a high degree of comorbidity, which is just a fancy way of saying they come often with other anxiety disorders. So if you have a specific phobia, you are more likely to either develop or already have another anxiety disorder as well. So in kids, there's the physical symptoms, okay, that look fairly similar to symptoms in other anxiety disorders. When they are presented with the situation, you will see things like increased heart rate, or sweating or trembling or shortness of breath. Kids saying, I feel like I'm going to die, or I feel like I'm going crazy. These are the physical symptoms that will go along with the phobia. You're also going to see most likely a really intense avoidance of whatever the phobia is, the object of the phobia. So the kid who won't go near the dog or won't even go outside because they're afraid that they may see a dog. Or you're going to see a very, very high level of anticipatory anxiety. That is that the child will start to worry, talk about, develop symptoms of anxiety in advance of actually being in the situation. Or at times, and it's less common, but we will also see kids who are able to face the object or whatever the feared stimuli is, but they're doing it with such a high level of anxiety that their normal routines and functioning are interrupted. It's really important to remember that having fears is also a normal part of childhood. Kids get afraid of the boogeyman. They get afraid of the dark. They don't want to go to the doctor and get a shot. But there's a real difference between sort of these transient childhood fears and a phobia. And, you know, the distinction is really in the intensity of the anxiety, the duration, how long it lasts. In order to get the clinical definition of a diagnosis of a phobia, it needs to be persistent for 6 months or longer. And also in the interference of functioning. How much does it impact the child's life at home or at school or relationships with friends or family or with their activities or extracurriculars? So like many of the anxiety disorders, the gold standard treatment for specific phobias is cognitive behavioral therapy, and specifically exposure. So the idea is that we are helping kids and adolescents to learn how to approach whatever the feared stimuli is, and that we are doing it in a very systematic and controlled way so that they can develop competence and confidence in approaching that object. So for, a dog phobia, it may look like something, first we're just looking at pictures, cartoon pictures of a dog. And then maybe we're looking at a real photo of a dog. And then we're watching videos. And then we're going to a pet store and we're standing behind the glass. And then we are walking towards the dog, and maybe therapist assisted or parent assisted. We're putting our hand on the fur, all the way building up to being able to have spontaneous interactions with dogs. And what's happening through exposure, which is the same as in many of the other anxiety disorders, is that the children and adolescents are getting the corrective experience that the feared stimuli is not as dangerous as their anxiety or their worry brain tells them it is. And so they are both desensitizing themselves to it, and they're getting new learning that the stimuli doesn't need to be feared and that they can handle it. In terms of treatment, we think of cognitive behavioral therapy as the treatment of choice for mild to moderate phobias. And again, this is similar across all the anxiety disorders. When we get to the moderate to severe range, the gold standard treatment is really a combination of cognitive behavioral therapy and medication management together. Good news is that phobias are not showstoppers, okay? And that they are very, very treatable with cognitive behavioral therapy. They're very, very responsive to treatment. I'll often ask parents to think about, what is the thing that you are most afraid of, right? And what does your body feel like? And what does your mind do when you're confronted with that? Because that is what your child is experiencing. That is how they feel, the adrenaline and the cortisol, the same adrenaline and cortisol that are going through your body if there were a 5-alarm fire and you had to flee or get out, is coursing through your child's body. They don't understand that it's a false alarm, and so it's our job as the parents or the clinician, help coach them to understand what's happening, because it can be very, very scary. In helping them to approach the feared stimuli, you are helping them to get their confidence back and for them to gain skills that they lose when they're avoiding. Because fear grows over time with avoidance. It never gets easier when you avoid something. It always gets harder. Because if you avoid going in the lake or you avoid the puppy, you are left with the idea, number one, that the puppy really was scary, right? You get the anxiety voice saying to you, hey, that puppy really could have been scary, right? It really could have bitten my head off or whatever it is you're worried about, right? And number two, it chips away at your self-confidence because you have the feeling, I had to escape and avoid in order to be okay. So putting our kids in the situation, even if there's some distress, helps them to gain the confidence of knowing I can do this, right? It's hard, and I don't love the way I feel, but I can handle this and nothing bad happens. It's just a cute puppy that's actually super fun to play with. A lot of the time, the phobia is set off by a negative experience that the child has had with the stimuli, or by watching someone else or the parent have a negative experience with the stimuli. And that's where it's really important as parents that we work to model, not that we don't have anxiety, because that's not realistic, but that things can make us afraid and scared, and we want to share that with our kids, and we can do them anyway.